provisions that tight regulation on assisted reproductive techniques, ART, strict penalties for offenders, not more than 3 embryo transfer for the same couple if the first 2 attempts fail, not more than 3 live births as surrogate. In case of relative, she should be of same generation as the intending mother. Dr. Lahiri has told that even relatives can opt for surrogacy, but the relative should be of the same generation, not mother and daughter, same generation. Should pass the surrogate intending surrogate mother should pass all the testable criteria to go through full term pregnancy. She should be totally fit and there should be documentation that I have already kept all the records that she is fit for surrogacy. And the draft legislation I have already told that it is there in the net, you can easily search, there is a PDF file, you can see that. Public health relevance of surrogacy, mushrooming of fertility clinics, increase in medical tourism, unregulated profit-oriented ART clinics with varying costs, standards and procedures, various complications of assisted reproductive techniques, low birth weight and malformed babies. This is basically they try to cover it up, but there are incidences. Less transparency in surrogacy contracts, problem of cross-border surrogacy, international surrogacy. A couple from Japan coming to India to have surrogate baby, this type of problems. This is, the picture is very clear that surrogacy industry, already an industry in India. Issues and perspective, a surrogacy arrangement should provide for the financial support for surrogate child before delivery of the child. In the contract, there should be already provision for the financial support of the child, life insurance coverage for the surrogate mother, legitimacy of the surrogate child, names of commissioning parents on the birth certificate. This is important to avoid legal complication. In the birth certificate, only names of commissioning parents, not the surrogate mother. Otherwise, there will be tremendous legal complication. Right of privacy of donor and surrogate mother, that is very important, and prohibition on sex selective surrogacy. Otherwise, most of the couples will opt for male child naturally, as the trend in India. So there is no, there should be a ban on sex selective surrogacy. Cases of abortion in surrogate mothers should be governed by MPP Act 1971 only. There is a printing mistake. 1971 only. Legal rights of surrogate mothers should be protected. Placing liability on the mother in the contracts for risks including pregnancy-induced diseases, death and postmortem complications. This is to be avoided basically. If the mother suffer from pregnancy-induced diseases, then there should be provision for total compensation. The liability should not be on the mother. So while framing the contract, this is to be taken care of. Psychological consent, there is a debate that how much psychologically